Welcome to Dr. Gore Show. Today's topic is colon cancer. What's that? To talk about this important topic which affects so many of us, we have the pleasure of having Dr. Sachdeva with us. So welcome to Dr. Gore Show.
Thank you, Dr. Gore, for having me. It's a pleasure to be here.
So Dr. Sachdeva started his career in medicine at NYU. Then he went on to do his studies in California, his residency in internal medicine. Now he's getting trained as a gastroenterologist, somebody who deals with your stomach to lining to colon and beyond at SUNY, and he's going to be a super specialist at Columbia. So, colon cancer, when we talk to patients, especially South Asians, they don't think it's something that affects them because a lot of us are vegetarian and we associate colon cancer usually with meat eating people, with somebody with high, amount of red meat intake. What do you talk to patients when they come and say, "Oh, doc, I don't need colonoscopy because I'm a vegetarian"?
That's a very good question. Thanks for asking. So there is an association between red meat and colon polyps, which have the potential to become colon cancer. So that association has been proven. However, everybody over the age of 50 needs a colonoscopy. And some societies recommend getting a colonoscopy over the age of 45 if you're of African American descent. So everybody is affected by colon cancer and colon polyps. Colorectal cancer is the second leading cause of cancer death in the United States. It is the third leading cause of cancer worldwide.
Wow.
So it's a prevalent cancer that affects everybody, everywhere, all over this world. So to answer your original question, yes, there is an association between red meat and colon polyps, but colon cancer is incredibly prevalent, and everybody needs colonoscopies and colon cancer screening in general to prevent progression of polyps to colon cancer.
So that's a very staggering statistics that second leading cancer death is because of colon cancer, and we have some way to kind of detect it early and treat it if be. So most of us we know about if there is a breast mass, go and get it biopsied, or there is postmenopausal bleeding for women, we get it evaluated, or if you are a smoker and you cough and there's lesion, there are certain symptoms. But colon cancer, sometimes there are no symptoms. So what do you tell patients that if you have A, B, C, this is kind of like a red flag, but even if you don't have it, just by age or family history, we are going to look for it. So walk us through if there are any symptoms which are associated with colon cancer, if be.
That's a great question as well. So there are symptoms that are associated with colon cancer and colon polyps. Unfortunately, though, the symptoms don't manifest until late in the disease. So colon polyps are often asymptomatic.
Correct.
So patients don't even know that they have polyps growing within the lining of their colon. And that is something that patients must be aware of. So getting screened for colon polyps is really the best way to prevent progression to colon cancer.
Right.
So in the early stages, you often don't know you have any symptoms. Later on, as you progress to baby colon cancer, you can get changes in bowel habits. You can get thinning of the stool or the caliber of your stool. You can get abdominal distension or bloating. Some patients have abdominal pain. And these are non-specific symptoms.
Correct.
Polyps can bleed, as can colon cancer, as there's increased vasculature, and those can bleed, so you can get rectal bleeding. But rectal bleeding can be caused by a number of things, most commonly hemorrhoids.
Right?
Hemorrhoids, exactly. So it's not colon polyps and colon cancer are often asymptomatic, so it's a silent killer.
Correct. So as Dr. Sachdeva mentioned, please keep a lookout if there's sudden change in bowel habits, right? I think when somebody who has constipation has diarrhea or alternating diarrhea and constipation, if the stool becomes darker when you're not taking iron, that means there are some internal bleeding, and then the stool can come darker thing. But there's a simple test in physician's office that can be done for fecal occult blood, and they do a rectal exam. They they put that stool sample on the. That's kind of like an easy way to screen people if there's any internal bleeding. But necessary is routine screening after age 50. What about the family history? Because a lot of times I find A lot of my colleagues, internists, they don't take a detailed family history. And we know that there is a big genetic link, and we know of like breast cancer, BRCA gene, we know that there are genetic predispositions. So do you want to tell us about the family history and why it is important to know that?
A family history is incredibly important as well. The reason why is if you have a first-degree relative with colorectal cancer, the screening guidelines change. You can initiate screening at the age of 40 or 10 years sooner than the first person who is diagnosed. Also, if you have a family history of polyps or a personal history of polyps, the colon cancer screening guidelines change. A family history of Crohn's disease or ulcerative colitis, inflammatory bowel disease also can increase your risk of colorectal cancer. There are certain genetic syndromes that are affiliated with colorectal cancer as well.
Syndrome.
The Lynch syndrome, familial adenomatous polyposis syndrome. So if you have these genetic diseases, you need to be screened much earlier in your 20s or even sooner than that. So taking a detailed family history and of a patient is critical because it will change the age in which you initiate screening for colorectal cancer. You mentioned earlier that there are stool tests. The colonoscopy is still the gold standard.
Absolutely.
And the other imaging and stool-based tests can also be used. But a family history is critical because it'll change when you initiate screening.
Correct. So screening is something that you're doing it before it becomes a big disease. You're looking to prevent something, and that's what screening is. Once you have something, then those are the diagnostics. So screening you want to start before one develops colon cancer, and that's why it's very important to know the family history. As you mentioned, if you know that one of your relative, your first degree, that means either your parent or your sibling had colon cancer at a younger age, then you want to start even 10 years before that. So rather than start at age 50, you might start it at age 35, 30 if they had it at 40 and 45. So it's a very important point to know that sometimes your screening age might differ from general population. And giving that history, be aware of that, especially ulcerative colitis. And we are seeing so many young kids suffer from that. And all those are predisposing factors. So we've done the history, we've got the family history, and they have referred cases to you now. A general internist, a family practitioner, or even an OBGYN. I make sure they get their colonoscopy done, and I refer them to a GI doc. Now this patient has come to you after long thinking and debating, just like mammogram. Oh, it's going to be painful, it's going to be bowel prep, and it's going to be so difficult. And I have to congratulate Katie Curry. She kind of brought colonoscopy to mainstream when she did it live. How do you counsel your patient when you have to talk to these patients about colonoscopy?
Well, first I want to say Katie Couric did an incredible job with promoting awareness for colon cancer and colon cancer screening. We're actually working with her group now, Stand Up to Cancer, on a huge initiative to increase public awareness for colonoscopies and colon cancer screening. To counsel our patients, we let them know that colon cancer screening is one of the best ways to prevent colon cancer in American and international medicine.
Right.
It is incredibly effective. Unlike other cancers, which are often hard to detect early, if you remove colon polyps, 90% of cases of colon cancer can be prevented just by removing these polyps. So this is incredible. It's absolutely incredible. So if we think about the numbers just for a second, colon cancer is the second leading cause of cancer death in the United States.
Right.
It's the third leading cause of cancer in the entire world. And it's 90% preventable by removing polyps before they become cancer. These are the stats. So to counsel patients, we tell them, if you get a colonoscopy at the age of 50 and you have a good prep and we remove polyps, you're not going to need another colonoscopy for another 10 years. And then if you may or may not have one more colonoscopy after that, you may only need 2 colonoscopies in your entire life. If you adequately take your prep, you're an average risk individual, and we remove the polyps, and depending on if you have polyps or not, you may get colonoscopies sooner. But the point is that you're not going to need these procedures very many times in your entire lifetime.
Correct.
So it's something that you have to do. It's something that you must do. It's something that you need to do because it can save your life. And so that's really how we counsel patients. As far as the preparation, nobody loves the preparation.
Correct.
It's salty, doesn't taste good, but it's something that you do only a few times in your life.
Correct.
So if you take that approach to it, you will more likely comply and actually get a colonoscopy or a screening test of some sort to be screened for colorectal cancer.
And exactly my point to patient is that if you start at age 50 and if there's nothing, it's done every 10 years. So maybe 4 times we might have to do this. Come on, it's not as bad. We all get diarrhea once in a while. It's not going to be bad than that. So, it sometimes it's hard, but once they come to you and you've explained that taking out the polyps, 90% prevention, I think that's a great staggering number to kind of motivate people to get this done. And now you've done colonoscopy and you find small polyps, you take them out. Do you change your management when they come back?
Absolutely. So that's a great question. So depending on the type of polyp that we find and the type of polyp that we see, we will make a plan going forward. So oftentimes after we perform a colonoscopy, we have patients follow us in clinic. We have them come back within a week or two. So polyps come in different varieties of sizes and sort of pathological diagnoses. When you look under a microscope, you see different histologies. So they look a little bit different. And the most common type of polyp is something called a tubular adenoma. And if you have that type of a polyp, depending on the size and the number of polyps, you may need a colonoscopy again in 5 years. If you have a more simple appearing polyp that's not as scary, you may need a repeat colonoscopy in 10 years. If you have a large polyp, 1 centimeter is the cutoff, you may need a colonoscopy sooner. So it really depends on what we see when we look under the microscope. And we'll use the number and size of polyps to dictate when we have patients come back for a repeat colonoscopy.
So, as medicine evolves, there are a lot of technologies can be used in different fields. And there was this big news about capsule, that you can swallow those capsule and you might not have to do a traditional colonoscopy. You can follow that capsule together and it's going to take multiple pictures as it passes through. What has been the experience with using those technology to get imaging of internals of your colon?
So the capsule endoscopy is a great test that we can use to look for, we primarily use it now to look for bleeding or other abnormalities throughout your digestive tract. Essentially, it's very good for looking at the small intestine at this point, as opposed to the large intestine or colon. There are new emerging technology and studies that are being done to see if there's capsule tests that can be used specifically to screen for colorectal cancer or your colon. Those are not yet mainstream. Maybe in the future we'll use these capsules to look specifically for polyps. But currently the capsule tests that we're using are primarily to look at your small intestine.
Okay, so it's mainly used for small intestine. So far we've talked about the prevention, the screening, why it is important, why not wait till it's too late to be picked up. And we're going to take a short break and we'll be right back. Welcome back to Dr. Gore Show. So far we have talked about why it is important to do screening, because sometimes by the time you develop symptoms of abdominal girth or your stomach getting really big or you bleeding on your backside, it might be too late. So please remember and do your screening. If there is any change in your bowel habits or any family history, please go for your screening. So Dr. Sachdeva, we talked about colonoscopy. You've taken out some polyps and unfortunately some might come back as malignancy, cancer. That's really a scary word to hear. And what do you tell your patients at that point? That you've picked it up and there is some more investigation which needs to know, and there is another specialist who needs to take care and do a surgery. So walk us through, how do you counsel your patients?
That's always very challenging. That's something that you work on every time you see a patient that's diagnosed with colon cancer. It's really an individualized approach because everybody responds to the news differently.
Right.
I often feel like it's very beneficial to have a family member or a loved one with the patient, because often when you use the word cancer, people get scared and they sort of stop listening when they hear those words. So I like to have a multidisciplinary approach. I like to have myself in the room with a family member and maybe even an oncologist with us in the room so we can better explain what we found. This, I think, works effectively so we can answer all the questions the patients may have. And we let them know that they're not in this alone.
Sure.
We're a team, and we are doctors, we're healthcare providers, we care and love our patients, and we're going to help them get through this. Colon cancer is beatable. Diane over here is a good friend of mine, and she's a living testament to somebody who is going to beat colon cancer. And she set up a Beat Stage 3, which is really an incredible group and organization to spread the word that we can beat colon cancer. So it's an individualized approach, and we let them know that we will win. We'll win together.
Correct. So, Diane, welcome to Dr. Gore's show.
Thank you for having me.
Congratulations on beating stage 3 cancer and your passion and all the work you're putting in to raise awareness. Tell us in brief about your journey. How was your cancer diagnosed? Did you have any symptoms? Do you have any regrets? Can you take us through your journey?
I was diagnosed March 7th, 2014, 3 years ago. And I initially was having a shoulder surgery.
Okay.
And I just went in for pre-surgical testing. And they found that my hemoglobin was in the single digits. It was
Correct.
5. And so they suggested that before doing the surgery, even though it wasn't bloody, that I go see a hematologist just to make sure I had enough reserve, God forbid anything
Correct.
went wrong. And they thought my iron was really low. After seeing the hematologist, he gave me iron infusions, enough to get me 2 weeks through the surgery. Completed the surgery, and they recommended that I go back because I was low again.
Right.
So I was treated actually a year with iron infusions.
And your periods were normal at this point? Your
They were
menstruation?
coming twice a month, though. They were coming twice a month, so that's what we all assumed for women.
Correct, right.
We can bleed other ways. That might have been the bleeding
The cause
source.
of anemia.
No one checked for cancer. I'm adopted, so I don't know my biological history. I was only 44, so I wasn't even of screening age, and I really didn't have symptoms. As we've been discussing, it was really silent.
Correct.
But if I have to think back, there were symptoms. I did have constipation all the time. I did have irregular bowel movements. I did have distended stomach. So I would have unmovable gas, like different periods in time, but always associating it with the period.
PMS,
Yeah.
all right. And
Yeah,
it's very easy to
absolutely.
blame it on something else.
Absolutely. And it wasn't until I stopped doing the iron infusions and I got sick and couldn't get rid of this cold. I saw a new physician, primary care, who suggested I see her string of doctors. I scheduled a GI appointment, and before the 2 weeks of making that appointment, I had rectal bleeding, which I just thought was a cycle.
Correct.
And as I went to change the sanitary napkin, sorry, Dr. Sanchdev, it was clear. And that's what prompted me to call the GI doctor, and she saw me right away. I did have hemorrhoids. She did an anoscopy in-office test. I did have some bleeding, but she didn't know what the blockage was. So we had a colon, that was a Tuesday, and on Friday I had a colonoscopy, and before she could complete it, she told me I had a tumor that was 5.75 centimeters large in my cecum, portion of my intestine, of my colon, that would have to be removed immediately. And so within 2 weeks, I became a cancer patient. I had a surgery to remove the tumor. They removed my appendix and 14 lymph nodes. And then I began chemo 2 weeks later. So
And here you are today.
Here I am today.
Looking as beautiful as ever.
Yes,
So,
thank you.
You know, a lot of times we physicians kind of never hear what patients have to say. Or sometimes it's hard because certain symptoms, as we discussed, can be associated with something else. And especially when you didn't have your family history, when you did have some irregular menstruation, you did have some PMS-like symptom, it's sometimes hard. But I think you did the right kind of approach, that we couldn't figure out the source of anemia, and that's one of the other cause that kind of, it's like a red light, right? To look for other causes. And in screening, I think apart from asking the difference in the bowel habits, I think sometimes unknown anemia, I think we get to have that red light that maybe it's a colon issue. Lucky for you, you found the right doctor who did surgery and you did chemo. But what motivated you to, take that as and spin it around and use it to get awareness, because it's very easy to sulk and say, oh, I'm a cancer survivor.
Yeah.
Oh, this, I want sympathy. No, you took that challenge and you turned it around. So what motivated you to start this organization?
I think when I was looking for resources in survivorship, I was so excited to finish chemotherapy, but I realized through treatment there was no visibility about it. There were no commercials like we're seeing now. We just had that conversation. So if I needed to ask somebody, well, I'm having skin toxicity, I think we forget that the side effects from chemo, even though you've done your treatment sessions, are far worse than going through the actual treatment. I lost my hair after chemo. I had skin toxicity, which are these breakouts after chemo. So when I was looking for some help, there wasn't anything. And so I called up American Cancer Society just on a whim, because I attended something that someone spoke at and wanted them to come to an event when we planned my celebration of life. We were like, let's have a birthday party. We're gonna celebrate no more chemo, 1 year chemo free. And my girlfriend threw me this big bash. I did a photo shoot and it was just like amazing. And I thought, why don't we do this for other people? American Cancer Society said, we can't send you anybody, but we'd love to have you as an advocate. So that's how I got involved with them, like by mistake. And then we just organically developed this organization to start a Fresh Start program for every woman or every man, every caretaker who's gone through this process or has been affected, to have them start over, take themselves back, restore your mind, restore your body, restore your soul and your beauty. And prayerfully, people continue to donate. In addition to that, we do these innovational, creative ways of getting the awareness out. So we had something big at Brooklyn Borough Hall where our Brooklyn Borough president attended and spoke about his own struggle with diabetes, which we're now finding out might be a precursor as well to colon cancer in the community. So just getting people to understand diet is important, being responsible for your own health is very important, and giving them the symptoms, like no one talks to them like this. When I say I had rectal bleeding, and I'm not ashamed to say I was a constipated person, but it did have to do not with specifically eating poorly, because I'm an educator, I'm a guidance counselor, so we often don't eat. So not eating is just as bad as eating the wrong things. So giving that basic information.
So those simple tips kind of can save somebody's life.
Absolutely.
So I'm glad you made that mistake of calling American Society, because that mistake and your personal experience, you've made it into such a beautiful thing. So Dr. Sachdeva, you and Diane have been trying to raise the awareness. You want to spread the word. And if there is a message for our viewers that to take home, that please do your colonoscopy, do the screening, tell your family and tell your relatives to go and get involved. What is your message?
Well, it's Diane's story just inspires me every time I hear it, and she's just an incredible person to work with. The message is get screened for colon cancer. It can save your life. There are numerous ways to get screened. If you're 50 years old, you can get either a colonoscopy, a stool test, an imaging test called a CT colonography. If you're 45 years old and of African American descent, you can get screened according to some GI societies, including the American College of Gastroenterology. Colon cancer is preventable, it's treatable, and it's beatable. And I think that as a society, we have to work together and have more meetings like these, more conversations about colon cancer. It's a cancer that's killing too many people, and it's killed too many people for far too long. And Diane and I are working together. In the last few months, we've brought in leading endoscopist, chairman at Columbia University, the clinical chair, Dr. Frank Gress, has been helping us. We've gotten the owner of the Los Angeles Lakers, my good friend, Jesse Buss, to help us. We've gotten the New York Society of GI Endoscopy, the American Society of GI Endoscopy, the American College of Gastroenterology. We're getting famous celebrities to come on board and help us. And we're spreading the word. And people have been doing this far longer than we have, but we need to work together. So I have to tell everybody, please get screened. Talk to your loved ones, talk to your mother, talk to your father, your brother, your sister, your aunt, your uncle, your parents, your religious leaders. Tell everybody that colon cancer screening saves lives. Yeah. And it really, really does, and it works. It really works, so
and there
please
is a
get
tool
screened.
to detect it early. Diane, what message you have?
Colonoscopy saved my life. I'm here today because I had one, may not have gone the traditional route of being screened early, but now my children know. And so because I'm diagnosed at 44,
Correct.
they'll be screened 10 years pre-me, which will be 30 and 34. So I would love for people to go get screened. The prep is not that bad. It's the best sleep you will ever have in your life.
Okay.
And it's the first 5 pounds you'll lose by just drinking
Absolutely.
something, right?
That's
So
a positive thing.
easy
There you
diet.
go.
And Beat Stage 3, our organization is excited about going around just telling people locally, globally about cancer awareness
And
colon
raising the
cancer.
awareness. And I hope all the best to you and your mission. It is amazing story. Thank you, Dr. Sachdeva and Diane, for your time and coming out and raising awareness. So the message is, please, please, please look out for the symptoms. If you are anemic, if you have any blood in the stool, or sometimes just weakness and tiredness and fatigue, or you're not fighting infection, anything like that, be a little bit skeptical. If something is not found, look for other things. Be persistent. Sometimes if you have symptoms and you ask your doctors, we'll look for things. After that, if you are screened, if anything is come positive, there are treatments. If any cancer detected in early stage, then the chances are much better. We don't have to wait till stage 3 and beat cancer. So please, screening is early detection, early treatment, and better survival. Till next time, good night.